When my mom became ill, my dad, my sister, and I, we had to make some decisions, some very important decisions for her. When you're going through that process, there's a lot of emotion. There's a lot of things that you're dealing with. And to add on to that, decisions that you need to make for a loved one, it makes it a very difficult time. So if you can talk to your loved ones before it gets to that point, you're really giving them the gift of clarity.
Conversation of Your Life is an initiative of the New Jersey Healthcare Quality Institute, a nonprofit organization dedicated to improving healthcare in New Jersey. The Quality Institute, which runs the Mayor's Wellness Campaign, gives mayors tools and support to make their communities healthier places to live. One thing we all struggle with is growing old and making sure that towards the end of our lives, our loved ones know what we want for our care. That's why we created Conversation of Your Life, so mayors could help their residents handle this challenge. Conversation of Your Life is generously supported by the Horizon Foundation for New Jersey.
When you look across the United States about how healthcare is used, for some reason, New Jersey and New York tend to have the highest number of days in the hospital, in the ICU, the highest number of tests and procedures at the end of life. Why is that? When we look at other regions of the country, that's not the case. And so, in large part, we think that it's cultural. We created this program, Conversation of a Lifetime, to create safe places and strategies, and then actually using legally recognized tools to help people communicate their wishes, then be able to be comfortable with having a conversation about it, and then also importantly to put it in writing in a legally recognized document, and then have it available for when the time comes that they need to use it.
We know that people in New Jersey want to die at home and not in the ICU in hospitals. But today it is more likely that a New Jersey resident who does not make their wishes clear will die in the hospital. That's a problem. Patients without advance directives or other end-of-life documents are more likely to receive unwanted medical interventions towards the end of life, such as feeding tubes and ventilators. Letting your family know what you want, or finding out what your loved ones want, is giving the gift of clarity and peace of mind and avoids conflicts down the line.
Well, I talk to families about end of life every day. My conversation with them is to give them a perspective of hope. That conversation of a lifetime is a part of the journey, and it helps them, because a lot of times family look at the destination. End of life can be frightening to people. Conversation of a lifetime helps them to make it beautiful.
Conversation of Your Life prompts community conversations in comfortable settings, like sessions at senior centers, local houses of worship, and libraries. Statewide events include film screenings, book readings and discussions, workshops with county surrogates, and more.
It's really important for all adults to have these conversations with their doctor, so the doctor is fully informed about their preferences, because everyone is different and everyone has different preferences regarding end-of-life care, what they would want and what they would not want. It's also important to know that for those people who have living wills and have this information in writing, it makes decision-making less burdensome for their loved ones. If they ever have to make a decision and you can't talk on your own to your doctors, at least you have the living will that they can reference.
There are several options for documenting your end-of-life care wishes, including an advance directive, a living will, 5 wishes, and PULST. Through Conversation of Your Life, we encourage you to take a look through these documents to decide what is right for you. Share your completed documents with loved ones and your healthcare provider. Keep your completed documents in an accessible location and revisit these documents every few years or whenever your health changes. Conversation of Your Life offers resources and programs throughout the state to help people get the conversation started.
When we come out and do a conversation, we talk about our documents that we have and what the importance is of them. One main importance, if you have assets, you have to have a will. Another thing we talk about is our funeral agent. A funeral agent is where you get to decide what kind of music you want, the flowers that you want. You put somebody in charge of your words, what your wishes are. The main thing about Conversation of a Lifetime is making sure that your wishes are fulfilled. We decided that we wanted to make the conversation lighter and so people aren't afraid to talk about it. So we have joined up with some other groups and we show a movie about end-of-life care, and then we're able to answer their questions. But most importantly, when we go out, we make it more of a conversation. We believe that you should be in control of your entire life.
Visit njhcqi.org/MWC to read the Conversation of Your Life resource guide. Find a list of statewide programming and other helpful literature.